All right, so let's just dive right into this deep dive on the latest in prostate cancer treatment. We've got a whole bunch of recent articles here covering just everything from new medications to even the impact of genetics.
Yeah, it's a really fascinating mix. There's a lot here that could really directly affect how prostate cancer is treated going forward.
So let's start with the clinical trials, specifically those using stereotactic body radiotherapy, or SBRT.
Right.
There are a number of ongoing trials investigating this in various stages of prostate cancer, and the results are really encouraging.
Yeah, they are. Very much so.
So one that caught my eye was the STOMP trial. It focused on men with oligometastatic hormone-sensitive prostate cancer, meaning the cancer has spread but only to a limited number of places. What's really interesting is that this trial showed SBRT could significantly delay the need to start androgen deprivation therapy.
And that's huge because, ADT is a common treatment, but it can come with some unpleasant side effects. Delaying that even for a while can make a big difference in a patient's quality of life.
Absolutely. Another one, the Oriole trial, looked at SBRT in men with oligometastatic prostate cancer as well. They found that SBRT alone, without any other treatment, could significantly improve progression-free survival compared to simply monitoring the cancer.
Yeah, and the long-term data from Oriole is particularly noteworthy. After 4 years, around 20% of the patients who received SBRT remained progression-free.
Wow, that is remarkable. Now, what about combining SBRT with other treatments? Are there any trials looking at that?
Yes, there are. The Extend trial, for example, combined SBRT with short-term ADT for men with oligometastatic prostate cancer. And they found that this combination led to better outcomes compared to intermittent hormone therapy alone.
So adding SBRT into the mix might enhance the effectiveness of other treatments and potentially allow men to maintain normal testosterone levels for longer periods.
That's the idea. There's also the AR-TOE trial, which looked at oligoprogressive castration-resistant prostate cancer. This is when the cancer is no longer responding to standard hormone therapies, but the spread is still limited.
Okay, so how did they incorporate SBRT in this trial?
They added SBRT to a new line of systemic therapy and found that it improved both biochemical response rates and progression-free survival.
It seems like even when the initial hormone therapies begin to fail, SBRT might still offer some benefit.
Yeah, it might delay the need for more aggressive treatments. Then there's the Prolong trial, which focused on patients with de novo low-volume hormone-sensitive prostate cancer. Basically, the cancer was hormone-sensitive from the start, and the spread was very minimal.
So what did they do in this trial?
They used a combination approach: ADT, androgen receptor pathway inhibitors, or ARPIs, and SBRT. The SBRT targeted both the prostate and the areas where the cancer had spread.
That sounds like a very comprehensive strategy.
Yeah.
And what were the results?
They saw significant improvements in survival rates, particularly for those with a low burden of metastasis. It really highlights how customizing the treatment to the specific characteristics of the cancer can make a real difference.
Now, earlier you mentioned that SBRT is even being explored in more advanced cases.
That's right. The ARREST trial looked at SBRT in men with polymetastatic prostate cancer, where the cancer has spread to many sites in the body. This is obviously a very challenging situation to treat.
What did they find?
Well, even in these complex cases, the ARREST trial showed that SBRT is safe and feasible.
So it seems there's a potential for SBRT to provide benefit across a range of scenarios, which is very encouraging. But of course, these trials are still ongoing.
Absolutely. We need more research to fully understand the long-term effects and to determine the best ways to utilize SBRT in different patient populations. But it's clear that this is a very promising area of research.
Definitely. Now, moving on from SBRT, there's another clinical trial I wanted to ask about, the CARE trial. It's testing a new immunotherapy called INKmune for metastatic castration-resistant prostate cancer. This seems like a totally different approach.
It is. INKmune harnesses the power of the body's immune system to fight the cancer, specifically by activating natural killer cells, or NK cells. These cells can naturally recognize and destroy cancer cells.
So how does INKmune help them do that?
So sometimes cancer cells are able to evade detection by these NK cells. What INKmune does is prime the NK cells, making them better at targeting and destroying the tumor cells.
So it's sort of like giving the immune system a boost.
Exactly. The therapy itself is quite interesting. It uses modified human tumor cells that can't reproduce, so they're safe. These modified cells interact with the NK cells and activate them.
That's fascinating. Where does this trial stand now?
It's still ongoing, so the full results aren't available yet. But this type of immunotherapy definitely holds a lot of potential for treating advanced prostate cancer. It's an exciting area to watch. It really does. It feels like a new era for cancer treatment, harnessing the body's own defenses.
Absolutely. Okay, so let's move away from clinical trials for a moment and delve into some preclinical research. There's a study here that caught my attention because it involves something we all probably have in our medicine cabinets,
Mm-hmm.
aspirin.
Oh, yeah. You're referring to the research looking at aspirin's potential role in preventing biochemical recurrence after prostate cancer surgery. It's certainly an intriguing finding.
Yeah, it's surprising. I mean, we typically associate aspirin with heart health, not cancer treatment.
That's true. But this retrospective study analyzed data from over 8,000 patients who underwent robot-assisted radical prostatectomy. And they found that those taking aspirin at the time of surgery had a significantly better 3-year biochemical recurrence-free survival rate.
So taking aspirin seemed to reduce the chances of the cancer coming back.
Yes. And the effect was particularly strong in patients with more aggressive forms of prostate cancer, those with an ISUP grade of 4 or higher. That's based on how the cancer cells look under a microscope.
That's incredible. Any thoughts on how aspirin might be having this effect?
Well, the researchers suggest a few possibilities. One is aspirin's ability to inhibit cell proliferation and angiogenesis, the process of new blood vessels forming that can fuel tumor growth.
Right. It's also a powerful anti-inflammatory. And we know that chronic inflammation can contribute to cancer development.
Right. It's important to note that this was a retrospective study, so we need prospective trials to confirm these findings. But it's a promising lead, and it could change how we approach post-surgical care for prostate cancer patients.
Absolutely. Okay, another preclinical study I wanted to discuss is the one on Batiraxcept. This drug targets a protein called AXL, which is involved in cancer cell growth, survival, and spread.
Right, AXL is particularly relevant in the context of bone metastasis, which is a common and often difficult to treat complication of prostate cancer.
That's right. Bone metastasis can cause significant pain and really impact quality of life.
Exactly. So in this study, they used human prostate cancer bone metastases and patient-derived xenograft models, which are essentially human tumors grown in mice, to test the effects of
What
Batiraxcept.
was they find?
The results were quite promising. Batiraxcept, both alone and in combination with chemotherapy, was able to suppress tumor growth in the bone. They also found that it reduced metastasis to the lungs, which is significant,
That sounds like it could be a real game changer for men dealing with bone metastasis.
potentially. They also looked at the effect of Batiraxcept on cancer stem cells, a small subpopulation of cells within the tumor thought to be responsible for tumor growth, recurrence, and drug resistance. Batiraxcept was shown to downregulate genes associated with these stem cells.
That's crucial. If you can target those stem cells, you might be able to prevent the cancer from coming back or becoming resistant to treatment.
It's a very promising finding. And Batiraxcept isn't just showing promise in prostate cancer, it's also being evaluated in a phase 3 clinical trial for clear cell renal cell carcinoma, a type of kidney cancer.
So if it's successful in that trial, it could have implications for treating several different types of cancer.
Exactly. It really speaks to the potential of targeted therapies like Batiraxcept.
Now let's switch gears and talk about some fascinating research in the field of genetics. There's a study here about a gene mutation that seems to significantly increase the risk of developing prostate cancer.
You're referring to the research on the WNT9B gene. It's a gene that plays a crucial role in the development of the prostate gland during embryonic development.
And what they found is that a specific mutation in this gene disrupts that normal development, increasing the likelihood of prostate cancer later in life.
Precisely. This study was quite extensive, involving around 500,000 patients from the US and Europe. What they discovered is that the WNT9B mutation can increase the risk of prostate cancer by 2 to 12-fold.
That's a substantial increase in risk.
Yes. It's comparable to the risk associated with mutations in some of the breast cancer genes, which really highlights the significance of this finding.
It has major implications for screening and prevention, too. Men who know they carry this mutation can be more proactive about their health.
Exactly. They may choose to start prostate cancer screenings earlier or get screened more frequently.
It could also lead to lifestyle changes or other preventative measures. It's a great example of how understanding our genetics can empower us to take control of our health.
Absolutely. It's moving us toward a more personalized approach to healthcare.
Now, there's another genetic discovery I wanted to ask about. It has to do with something called extrachromosomal DNA or EcDNA.
Yes. This is an area of research that's really starting to shed light on the mechanisms behind treatment resistance in cancer.
For those who aren't familiar with ecDNA, can you explain what it is?
Certainly, ecDNA are small circular pieces of DNA that exist outside of the chromosomes. What's interesting is that these ecDNA can carry genes, including those that can contribute to cancer development and progression.
And in the case of prostate cancer, what they found is that ecDNA can lead to overexpression of the androgen receptor, or AR.
Right, which is a major driver of prostate cancer growth. When the AR is overexpressed, the cancer can become more aggressive and more resistant to treatment.
And that's precisely what this research demonstrated. They used a technique called multi-omic data integration, which is a very comprehensive way of analyzing the genetic makeup of cancer cells.
And they discovered that in some cases, the AR gene was actually located on these ecDNA elements. This means that the AR gene was no longer under the normal regulatory mechanisms of the chromosome, and as a result was being overexpressed, leading to more aggressive tumor growth.
This finding seems like it could have huge implications for how we approach treatment.
It does. It suggests that we need to find new ways to target these ecDNA elements. It's a whole new avenue for research and drug development.
Yeah, it's amazing how much we're learning about the genetic underpinnings of cancer these days. It's really opening up new possibilities for treatment.
It is. And it's not just about targeting the cancer cells themselves, it's also about harnessing the power of the immune system. And that brings us to our last study, which looks at a potential breakthrough in cancer vaccines.
Yeah, this research caught my eye because it involves a new delivery system for peptide-based cancer vaccines.
Right. The challenge with traditional peptide-based vaccines is that they often struggle to generate a strong enough immune response to be truly effective.
I see. So that's where this new delivery system comes in. They're using something called lipopeptide hydrogels, or LPHs.
Right. LPHs are a type of material that act as a depot, slowly releasing the cancer-targeting peptides over time. And that's key because it ensures the immune system is exposed to the peptides for a longer period, increasing the likelihood of a robust and lasting response.
So it's not just a one-and-done type of exposure.
Exactly. And on top of that, LPHs also function as an adjuvant, which means they enhance the immune system's response to the peptides.
It sounds like a two-pronged attack, addressing both the delivery and the effectiveness of the vaccine.
That's a good way to put it. While this technology was initially developed for a type of liver cancer, the researchers believe it can be adapted for prostate cancer as well.
So if they can tailor it to deliver prostate cancer-specific peptides, it could lead to much more effective vaccines for men with advanced or recurrent prostate cancer.
That's the hope. It's still early in the research, but it's a very promising approach that could significantly impact how we treat this disease in the future.
Well, we've covered a lot of ground today, haven't we? From clinical trials exploring the potential of SBRT to preclinical research on aspirin new drug targets and genetic discoveries. It's clear that the field of prostate cancer treatment is rapidly advancing.